Hello, I'm Stefano del Giacco, and I am professor of allergy and clinical immunology at the University of Cagliari in Italy, and I'm also IACI Vice President Education and Specialty.
And the subject is the item is that the first question is what is precision medicine?
Well, precision medicine is, I would say, a dream came true because it's the famous magic bullet that all the doctors wanted to get. In a way, somehow we were always looking for something that was targeting precisely the target without harming the rest of the body, for instance. But this is nothing new, because it builds up on already Hippocrates, for instance, was saying, don't ask which disease has the patient, but which patient has the disease, meaning that each patient can have his or her own characteristics which make his type of disease very special, that maybe can need special treatments and precision medicine in that case.
And what are the big challenges?
Well, the big challenges are many because it's something very new. So it's something that has just started, I would say. The big challenges are, first of all, to gather the data, because precision medicine relies on big data. We need many information on each disease. Asthma, for instance, is a typical example. We have many types of asthma. Until a few years ago, we were using the blockbuster medications, so the sprays and everything that are perfect still today for most of the patients. But for some of them, they don't work. So why they don't work? So you start gathering the data, and we say collecting, connecting, analyzing. So we have to collect the data, connect the data, analyze, and try to understand what is the factor that is creating this disease, and then finding the right cure.
And how can precision medicine help in the allergy field?
Well, the allergy field, I think, is the perfect one for precision medicine. It's allergy is based on immunological mechanisms. So we have antibodies that, for instance, that target a receptor. So the receptor is a perfect target for a precision medicine, because you just go to hit there, or to block it, or to stimulate it, or to block some factor which is in the blood. And so with that you can really try to focus on the real cause of the disease.
And what are the most important tools used in this approach?
Most important tools are actually big data, as I said. I mean, so computer technology, of course, and then very important are the omics science, the so-called omics science. So genomics, metabolomics, proteomics, which can tell us and predict through the examination of some of blood or saliva or other fluids. We can understand which proteins are there, and these proteins are connected to a certain type of asthma, for instance, and then we can already decide in advance which cure give to this patient.
And what are the potential drawbacks of this approach?
Well, the drawbacks are many. First of all, costs. Because, for instance, Obama, the President of the United States, launched a famous campaign on precision medicine and gave a lot of funds for this. So money is needed. So it's something that needs to be strongly funded, because it's a huge project that has just started. So this is one of the main drawbacks, because of course poorer countries cannot do this. And so the largest one and the richest one must be the drivers for this. Other drawbacks in other fields, for instance, are the cost for healthcare, because once you have paid the research, then healthcare, of course, must reimburse these medicines, which are very costly. And so patients want these medicines, and the national healthcare systems must pay these medicines that cost several thousands of euros, for instance. And so they absolutely must find the right way in between the cost and the request of the patient. Further drawback could be the possible philosophic effect, I would say, which is patients that are taking normal medicines, in a way, they could complain, saying, I want a precision medicine. And so we must make the right information possible to let them know that precision, some medications are only reserved to specific patients. For many of them, probably still the blockbuster can work. But anyway, it will be it's an evolving world. Maybe more surprises will come, and we could probably in the future will be able to exactly phenotyping and endotyping the patients, meaning that we will have to go in deep in his disease to understand all the details and find the right drugs.
And how does the support from the EU look like in terms of funding?
Well, of course, nowadays many projects on precision medicine are on. It's not only in allergy, of course. For instance, one of the fields which that changed dramatically with precision medicine is cancer. Now we have precision medicine for cancer, and some types of cancers are really changed like this, you know, something like people that had a low expectation of life, now they live. We don't know yet how long will they live, but they live for a long time, and this is a great success. And of course, many projects are on this, and many applications for European funding are there. Of course, this is something really a big change in history of medicine. So I think that Europe will have to focus even more on funding these kind of projects.